Deciding on a treatment plan is a common challenging issue people face following a diagnosis of cancer. Throughout this part of the DVD, you will meet Dr Peter Chong, a urologist, as he discusses the issues surrounding treatment decision-making and how couples can get the information they need to take an active role in making their treatment decision. You will also meet Graham and Tony, both diagnosed with prostate cancer, and their wives Annette and Tina, who talk about the process they went through to make their treatment decision.
Well, treatment decisions are very difficult because most patients, when they get told a diagnosis of cancer, find it quite an emotional experience. And I find personally when I speak to patients and tell them a diagnosis, most of the time they don't hear much of what is said after the word cancer. Cancer is an unfamiliar topic and medical language has a lot of jargon in it. So often the information that they get told is a lot for them to take all in one go.
The uncertainty of it all was very overwhelming. There was just so much I didn't understand. The decision I'd make, my life could virtually depend on it.
We found it very challenging. We really wanted to read everything that we could, but that also made it very confronting. That made it very hard to know which way to go, what options to take.
In some ways, the treatment options that were presented to us were a bit limited and not what I was expecting.
We also had some big concerns about the treatment options. We didn't know whether we'd be able to manage them, what the long-term impact would be.
Well, not understanding the diagnosis means that effectively the patient's not getting informed consent. So to be able to make a decision in knowing what the right treatment is depends on knowing what the diagnosis is and what the treatment options are. So ultimately, if the patient doesn't know what they've got and the reason that they're making a decision, then ultimately they're probably not getting the right treatment for them.
When it came down to it, some were quite clear, like surgery. The doctor explained exactly what would happen and I understood the ramifications of that decision, whereas radiation, didn't know much about it, or after effects, or the whole process. I really wasn't clear about it, and I wanted to stay with it, the option that I understood.
I found the whole issue very confronting, and I was very upset, especially when I had so few options. At first, I was just going to listen to what the doctor said and take his advice, but it started stressing me out. I was having trouble sleeping, and I couldn't concentrate on work.
I could see this was making a really big impact on Tony. So I suggested to him next time we saw the doctor, we sat down and had a really frank talk with him. At first, Tony was really hesitant to do this as he didn't want to upset the doctor, but he did eventually come around.
I mentioned to the doctor that I felt trapped and I didn't really like my options. He then explained to me why they were the only options for me. So then we were able to weigh up the pros and cons and work out what else was available for us.
The personalities of patients and their partners is the major driver into how active and passive the patients want to be. So some patients I find are quite passive and are happy for me to tell them what I think is right, which I think is fine as long as they feel that they're being adequately informed about what all their options are. On the other hand, you can have patients that are quite active in wanting to know absolutely everything so that they feel that they're part of the decision-making process. And certainly that's my job as their doctor, to make sure that they're well informed and that we go through together in making the decision as a team. Seeing your doctor as a couple and a partnership is very important because on some occasions I can find that the patient is quite passive but their partner may be quite active, and ultimately if the partner's going to be the main carer and the main person offering emotional support, then I have to make sure that the partner is also involved in the process, particularly if they're an active decision maker.
I was extremely involved right from the outset. In fact, the decision I made wasn't the decision that the doctor would have chosen. But he did listen to me, and after I explained my feelings for choosing surgery, he got on board with me and supported me from there.
At first, we were just going to follow the doctor's recommendations. And I felt really overwhelmed with the information that I was getting. The treatment options that I had were very limited, and I was really uncomfortable with the choices that we had. In the end, we talked about it a lot more, both with the doctor and the oncology nurse, and we decided that we would get a second opinion.
In the end, it really was a joint decision. We were left wondering how these options would impact on our life together. At one stage, it just seemed like that was all we talked about. We gathered the information from both specialists. We got the information from several organisations, and it came to a joint decision together that we're happy with.
The aids that I use in my practice are things like brochures, DVDs, information pamphlets that I give to patients that help them focus on what's important in their type of cancer and in their lifestyle that they see as being paramount in making their decisions. There is so much information, and often there is so much in the way of treatment possibilities. Decision aids at least can help patients and their partners focus on what is important to them.
I was given a good book by my urologist and some really top brochures, but I believe you can never read enough. I couldn't get by without that sort of thing. But being in a written form, I could read and digest over and over again till it was satisfactorily clear in my own mind. I felt like we had different information needs. I can't read enough. Couldn't get my hands on enough information, whereas I sort of had the feeling it was all too much, or getting too much for my wife here. Sorry. So I'd try to summarise, the volume of what I was taking in and share that with her, in smaller doses that she could take on board.
Well, I had very limited knowledge, so I thought I'd hop on the internet and I looked for places that I knew the right sort of information for me would be there, like the Cancer Council. We talked about that information, we took it to our doctor, and we started taping all of our appointments so we could go back through the information if we needed to.
The patient or the couple feels that they've got too few options. There's always the opportunity to get a second opinion. Personally, I don't feel offended if a patient requests a second opinion, because ultimately what I tell them is what I think, so it is ultimately an opinion. In terms of second opinions, I think it's very important that they inform their local doctor and also the specialist that is treating them. Ultimately, you want to make sure that everyone knows what's going on so that everyone's coordinated.
Although I trusted him, I felt that our options were limited. And I thought, well, we need to know more. We need to find out if there are more options for peace of mind.
The urologist was very understanding. He gave us a couple of names that we could go see. In the end, they both came back with the same options for us. So we were very happy with the way the first doctor handled our situation, was very understanding, so we returned to him.
Having a doctor who was willing to listen to my concerns and willing to refer us for a second opinion really made a big difference.
Ultimately, if couples and the patient isn't understanding what's going on, really the first port of call should be back to the specialist who gave them the diagnosis. If they feel more comfortable talking to their GP about it, that's also a very appropriate first port of call. So making another appointment to that specialist to let them know that they haven't quite understood what's been going on is probably the most important thing. There are support groups and websites and information booklets that can help, but personally I feel nothing beats speaking to your specialist face-to-face. If you do have additional questions, I always make sure that my patients write everything down, and when you attend the appointment, even if it's not necessarily the patient that's asking the question, if it's the partner that's asking the question, I think that's entirely appropriate. In terms of what the support personnel or the wife, the couple can do, is make sure that they attend the appointments. If there is any reading that I give them, make sure that they read it with the patient. Often I give them a lot of organisation or contact details to get in touch with, like counsellors or support groups. And I find if they are helping the patient and attending those sort of appointments, that can help a lot in not only providing emotional support, but also helping them get through that decision-making process.
Continual discussions with the doctor each step of the way is so important. Sometimes I have to slow him down to pick up the medical terminology for any lay person is bewildering, but he is very helpful with that.
Also, they encouraged us to ask the doctor a little bit more questions, and we were able to then sort of make those appointments a little bit more fulfilling.
When we realised we were concerned about the treatment options, we grabbed the Coping Together booklet and we wrote down some question topics that we could ask the doctors. We sat down and asked both the doctors this question checklist, so we made sure everything was covered. Taping the appointments, having questions to ask, so nothing was forgotten. That gave me a lot of confidence over time.
Asking questions from your healthcare providers and being honest with your doctor. I got the impression that my doctor thought I knew more initially about my situation than what I actually did. So it is important to ask these questions so he can find a different way to make you understand.
Treatment decisions are complex, so it is important that couples understand the options. Couples should be as actively involved in making the treatment decision as they wish to be. Asking questions and using decision aids can improve your understanding. Discuss the information you get from other sources with your doctor. It is your right to seek a second opinion before making a treatment decision. The Coping Together booklet and website have numerous strategies to assist you through the decision-making process.